Hello there, you're watching the press preview. A first look at what's on the front pages as they arrive in the next half hour. We'll see what's making the headlines with the new Statesman's political editor. There they are, Stephen Bush, and the Spectator's economics correspondent, Kate Andrews. But first, let's see what's on some of those front pages. The Metro leads with an apology from Health Secretary Sajid Javid for tweeting that people should no longer cower from COVID, a statement that many Twitter users insisted was disrespectful to those who have lost their lives to the virus. The Guardian claims an exclusive with a warning from doctors that increasing numbers of young people are being admitted to hospital with COVID and urging youngsters to get the vaccine. The Telegraph reports that union leaders are fighting government plans to end the pingdemic, which could cause problems for shoppers, holidaymakers and commuters. The Mail reports that as many as 50,000 new cases of dementia went undiagnosed last year, in large part because referrals to memory clinics were stopped because of the pandemic. The FT understands the government is looking at ways to stop the Chinese state-owned nuclear energy group from being involved in any future UK projects in the sector, while the Star claims that, breaking wind can spread COVID. Oh, delightful. Well, we're joined tonight by Stephen Bush and Kate Andrews. Thanks a lot for joining us. Let's not cover that one. Let's, however, start with the Daily Mail. This is something that we're going to be dealing with for decades, isn't it? The fallout from the pandemic. Kate, you want to just take us through this, the COVID dementia disaster?
Yeah, the front page of the Mail today, as well as many of its inside pages, is highlighting many of the medical problems that have developed over the course of the past 16 months as patients were not properly diagnosed due to the situation that we were in. And the Mail front page is highlighting that 1 in 10 new sufferers from dementia are thought to have gone undiagnosed, and they think this could amount to 50,000 cases. If you look elsewhere in the Mail, they're looking at strokes, heart attacks, and the fewer hospital admissions that took place over the course of the past 12 months due to a series of restrictions and lockdowns. And this echoes what the new Health Secretary, Sajid Javid, said a few weeks ago about how they suspect that over 7 million people did not come forward for some kind of ailment. And it is a stark reminder of the catch-up that we're going to have to play. But also, very sadly, there are going to be many people, whether they're dementia sufferers, cancer sufferers, and the rest of it, who are going to have a very different trajectory with their ailment now because they didn't get care as soon as they needed it. These are the harsh realities of the trade-offs that we've had to face. Nobody wanted to see the health service overwhelmed. That would have been very frightening for a myriad of reasons. And yet we know that possibly millions of people have gone underdiagnosed or undiagnosed during this time. And that is going to be, the repercussions of that are going to be with us for many years to come.
And the problem with so many of these conditions is that help is most effective the earlier you get it, isn't it? Stephen, just one line I'm reading there on the front of the Daily Mail. It is feared that even more cases will be missed if virus restrictions return in autumn or winter. I mean, this is something that some people are saying, isn't it, that we may be in lockdown again if things don't go well for us. I mean, what do you think about that line?
Well, yeah, this is the fear, right? And then the government's approach right through this pandemic has been essentially to be as open as they think they can get away with before NHS capacity keels over. Now, if it turns out then we've got that balance slightly wrong and NHS capacity does keel over, then of course the only way that you prevent the sort of collapse of healthcare systems is for us all to go back into lockdown. However, the thing I think is important to note about that line is, while it is undoubtedly true that during the lockdown people didn't get medical treatment that they should have got, at no point were people being told not to seek medical help for things they needed. That was an example of people going further than the law and further than guidance suggested, which I think does show how it's very important for politicians and all of us in any form of public eye to be careful about how we talk about the next lockdown, because it's clear that a large number of people thought that they were doing what they had to do by avoiding getting important medical treatment and getting things checked out during lockdown 1 and lockdown 2, when the reason we have lockdowns, even though they're awful and we should try and avoid them, is precisely to preserve healthcare capacity so people can have those all important healthcare emergencies.
So keep getting checked, even if you find it a bit difficult to see your GP. Just keep trying. Let's stay on this story, but look at page 8 of the Mail, because this says, as cases plunge again, are we past the peak of the third wave? And they're saying it's the first time cases have fallen below 30,000 since July the 6th. And the last 5-day run of falling numbers was in February, shortly after the UK passed the peak of the winter wave. Kate, what do you make of this? Because these figures don't take into account what's happened in the last week, do they? I mean, the figures, they're delayed a bit, aren't they?
Yes, they are delayed. So they're not reflecting the reopening on the 19th of July, so-called Freedom Day. But look, on the face of it, good news. There could be a myriad of reasons for the spike. Of course, we had the Euros. We had significant social mingling indoors and out around the Euros. And so this peak could have been reflecting that surge in cases due to the football. It's also thought that the reopening on the 17th of May in England would have triggered a significant rise in infections, because that was the moment that people started socializing again and moving indoors. And we know that this virus is most likely to spread in enclosed spaces with poor ventilation. And so that move indoors, a lot of people think, will have actually had a bigger impact than perhaps what we're going to see from the 19th of July. But we have to keep an open mind. It's great news that cases are going down. But, you know, this virus does continue to surprise us, and we may well see another spike due to the most recent reopening. The really good news, however, is that as cases have been going up, hospitalizations have remained about a quarter of what they were when we saw previous peaks in this virus, showing the link between infection and hospitalization has been severely severed, I think, not completely, but quite notably severed thanks to vaccines. So we are able to deal with peaks in a different way now.
Let's stick with that, but look at The Guardian, because they say they have this exclusive that young people, they're being urged to get the jabs by doctors, because doctors are saying that ICU admissions, younger people, more and more younger people are being admitted to ICU with COVID. Stephen, what do you make of this?
Well, this is obviously an important story, and it's why, why everyone should get a jab as soon as they're offered one. But we would expect this, because although the coronavirus affects the elderly much more severely and in much greater numbers, 1% of a very big number, which is the total number of young people in the UK, is still a very big number. And it's a number that, even though young people with COVID who go into ICU will come back out again, it's still ICU capacity that is being taken out of commission. And because the disease spreads so easily in confined settings, it also has a much bigger effect on ICU capacity, because if I'm in an ICU bed with COVID and someone's in a car accident, they don't have COVID, they can't then be in the ICU bed next to me, because I might give them COVID at a time when they're already very vulnerable. So this is a reminder that just because those of us who are lucky to be under median age are more likely to be fine, it doesn't mean that there aren't impacts for ourselves and also impacts for society as a whole. If people sort of take the message from that, then, oh, well, I'll wait for my jab until, I'm 45, 50 and in an age when I need to get one for myself.
Kate, what do you think? Professor Adam Finn from JCVI has said there have been close to 200 admissions with a mean age of 40 in the city, University of Bristol. That's during the Delta variant wave. Do you think this sort of a headline, this sort of a story, an exclusive from The Guardian, will actually get people out and getting their jabs?
Look, I think it helps to highlight it, but I think Stephen put it into perspective very well. The young people who are going into the ICU are more likely to come out of the ICU, so we have to, keep that broader picture in mind. But nobody wants to go into the ICU. Nobody should want to get COVID. It's a nasty virus, and even though the people who are taking up the vaccine slower are in this younger age group, nobody really wants to get it. It's really important to get your jab and also to get that follow-up second one to make sure that you are to make sure you're fully protected. We are seeing a slower uptake now amongst young people. I do think headlines like this, you don't want to overstate, you don't want to understate. Really, you want to educate about the value of the vaccine, the safety of the vaccines, and why it's important to get it, not just for yourself, but to help the community around you too. But yeah, I think Stephen put it into perspective well. These people are much more likely to come out of the ICU. It is not like what we were seeing last year when there were no vaccines available, but let's try to avoid that situation completely. If you have a working vaccine, that is a much better option than finding yourself in a situation where you're unlikely to be very sick, but you could be, and that could, prove very harmful down the road.
Yeah, okay. We're going to take a break. Stephen, Kate, see you in a minute. Coming up, why is the government looking to stop Chinese state involvements in the UK's nuclear energy projects? We're going to be discussing that. Hello again, you're watching the press preview. With me now, Stephen Bush and Kate Andrews. Hello again to you both. The Financial Times, this is interesting. Ministers are trying to ditch a Chinese partner that they have in a nuclear program. And this, of course, comes after the Foreign Secretary said that the UK can no longer conduct business as usual with Beijing. Stephen.
Yeah, this is a really important story on several fronts. The first reason is, of course, for most of the last decade, we've had a very open policy as far as Chinese investment, Chinese money, and relative proximity to the Chinese state. Now, of course, the reality is proximity to Chinese businesses is the same as proximity to the Chinese state, because that is essentially the condition of carriage if you are a business operating in China. But as a result of a number of things, COVID in part, but in large part actually due to the repression of Hong Kong, the British government now finds itself at odds with the Chinese government, with a parliamentary party that very much thinks they should be going further. And you can argue about whether it's the right policy, but it is a policy with quite big costs, one of which will be the future of various nuclear projects and making them slightly more difficult than they have been perhaps in the past. And this is kind of, I think, in some ways, the first big sign that the government is willing to make actions match words.
It's interesting because you say that is, how things operate in Beijing. But Huawei have always said, we aren't the Chinese government, we aren't the Chinese government, haven't they, Kate?
Well, yes, they have. The connections are clearly there. And as Stephen says, if you're dealing with big business in China, it's almost guaranteed to be wrapped up in the CCP in some capacity. And, the pushback on Huawei and its connection to the 5G network would naturally extend then to nuclear energy, especially when we're thinking about something so fundamental to the UK infrastructure. But if you speak to certain Tory MPs concerned about the state of the UK finances, this is again where really difficult trade-offs come in, because if the government wants to hit its 2050 target of net zero, and it's well aware the UK taxpayer isn't going to be able to pay for every single penny of that, it's going to get serious about nuclear, and it's going to have to look for investment from the private sector. But as that's the big question around this. It's not like dealing with normal aspects of the private sector, about dealing with business that is wrapped up in the CCP, and that is clearly something that's changed very quickly. If you're looking at Parliament, its attitude towards business and the government in China.